Hmm. Hi, my name is Carrie Jones. I am a student at Aspen University in the Nursing Science Master's program with a specialty in education. And my project today is on the use of simulation for nurse education. So it's educating and bridging the gap for nurses that are out of school and have been out of school for a while. It's bridging the gap between theory and practice. So the objectives today we're going to look at is the introduction to simulation, the types of simulations, benefits to simulation, pre-briefing and debriefing, which is very important, usually before simulation and after, and challenges and limitations with generally with simulations in the community, which could be funding, could be getting mannequin and whatever other training tools needed. So, introduction, you may wonder why simulation plays a large role in your nursing education. So lectures and textbooks are great starting points, but to become competent in nursing practice is essential. Simulations are created to mimic real healthcare settings and allows you an opportunity to practice what you have learned in your nursing classes or on the job. I'm placed in a clinic, which is in community-based nursing clinic in Toronto, and I am going to implement simulation for some of the nurses that I've observed where they are maybe having issues or lacking confidence in. So simulation helps to build on confidence, critical thinking skills, and decision making for nurses in any environment, such as schools, hospitals, and community clinics. And this is Albie Neff Mellon et al. 2024. So this is a video you can click on at any point while you're watching this, and it will give you a gist of what simulation labs look like and how it aids nurses through practice and skills. So it's honing their skills that they already have, but keeping them, let's say, fresh and keeping them up to date by using this type of technology. So simulation When we think of simulation, it uses advanced technology to provide a more realistic patient scenario. So with my project, I created three patient scenarios. One would be wound care, IV, and filament testing for primary prevention for diabetics. And use of lifelike mannequins that can mimic various medical conditions and respond to interventions. A great way to practice in a safe environment, dealing with complex procedures that allow nurses to critically think in a controlled environment and a place to make mistakes. So these simulations are ideal for practicing any kind of skill to improve those skills. We're trying to improve on them. We're also trying to keep them continuously in your brain. Even though you don't use these skills on a daily basis, this is what simulation also provides is knowledge, reintroducing that knowledge and skill that you already have, but just kind of in just perfecting it a little bit so that you can utilize the mannequin to hone those skills and then be able to provide the patient with better outcomes and better patient delivery once those skills are honed. And this is Carrie Rossler, 2023. So the different types of simulation mannequins is high validity. So with high validity mannequins, they blink, they talk, they move. They can talk via, like for example, your professor could be talking into the mannequin, telling you what the mannequin's feeling, what you need to do. So it makes you critically think on your feet and you'll be able to assess this mannequin. You'll be able to take vitals, you'll be able to check breath sounds, you'll be able to do pokes, and do wound care on this high validity mannequin. Another mannequin is the low validity mannequin. The low validity mannequin is less expensive and easier to use. Uses basic mannequin and role playing. You would practice basic skills such as physical assessments, communication that is less complex. So IB, checking vitals, and assessments. So this is, oops, sorry. So that is the low validity mannequin. This is my setup here. This would be considered a low validity mannequin. It doesn't talk, it doesn't move, it doesn't anything. It gives you, this is a wound care one that we use for wound care for diabetic patients, different levels of wounds, as well as filament testing. And then you have virtual simulations. And with virtual simulations, we're looking at like courses such as Shadow Health, where you're working on a program. So this puts students in a digital environment where they can interact with virtual patients. Like I said, Shadow Health Clinic, this type of simulation allows for repeated practice in different situations. This simulation provides nursing students with a more flexible and safe way to develop their clinical skills without having to use physical equipment. This is from Carrie and Rossler, 2023. I have done Shadow Health a few times, and yes, it is a great way to hone your skills as well. However, I find it a bit challenging because you have to ask certain questions in order to gain the points for, and I did this for physical health assessment. So it can be a bit challenging, but it keeps you on your toes and it keeps you thinking and keeps you thinking about the decisions you made and why you made those decisions. So it's another great tool. So the benefits of simulation, oops, sorry. The benefits of simulation is you're looking at safe learning environment, risk-free practice, skill development, so critical thinking, decision making, building confidence, communication, and the best one yet is collaborative teamwork with other healthcare professionals. So setting up a scenario and teaching a nurse. So while observing nurses in the community clinic, I noted that some lack confidence in their wound care skills. Um, this is due to very vague referrals coming in from doctors, patients being discharged with a wound, and doctors saying, please, cleanse the wound and dress the wound. So, with that being said, you have to really know what level of wound it is. You have to make sure that you're measuring those wounds. You also have to make sure that you're using the proper dressing. If there's a lot of sanguine serous drainage coming from the wound, or a pungent odor, or pus coming from the wound, you have to know A, what dressing to use that is well absorbent, that it doesn't saturate the wound edges. So you want all the drainage to go into that dressing and how often that dressing is to be changed depending on the drainage, as well as you want to know if there's slough, which is a thin white layer over the wound that is covering the new granulated tissue underneath that. So you want to use products to remove that. You also want to use products to dry out the wound so that it produces less drainage. So there's a lot of things to think about when dressing a wound and staging and sizing and measuring and stuff like that. So to address this, I created 3 different scenarios I plan to use. This is the mannequin I plan on using for the simulation is a foot mannequin for wounds, filament testing, and an arm for IV. This will allow the nurses to practice proper wound care, IV, and filament techniques and provide patient education during care. So that's one of it. These are the setups that I have here. Pre-briefing and debriefing for simulation is very important. Pre-briefing consists is you're setting the tone of what is expected for the simulation, reviewing the simulation goals, and outline expectations. So the goal is to create a safe environment for learners. This is Hughes and Hughes 2023. So debriefing takes place after the simulation. So the value of simulation-based education is required a structured debrief where nursing students and healthcare professionals can reflect and think critically about their learning experience with this. This is Korzowski 2021. Sorry if I mispronounced that. So you're reflecting on critical thinking, learning experience, encouraging emotional process, improve teamwork and communication skills. This is all part of the debriefing process. So this is very important. It's a way to gauge nurses in how confident they are, or if they need more practice, then you allow that to happen as well. So these are key aspects that I'm looking at and hoping to implement in this clinic. So challenges and limitations to simulation. This is a high validity simulation here. Pediatrics, so co the high cost and resources, depending on the mannequins that you're using, I don't think that the clinic I'm in needs high validity simulation. I think they need a low validity, which is less expensive, around anywhere from $3,000 to $5,000. Access to technology, limited access to facilities, ensuring consistency and simulation quality, not enough experience with instructors, sorry, and apprehension from students due to stress and anxiety. So that is also from Krosowski 2021. And this is just my references. I like to hear your thoughts on simulation, if you think it is a good tool to use for nurses in community settings, in acute care settings, clinics, just a way to refresh and rehome their skills. Thank you so much for listening to my presentation. I look forward to seeing your feedbacks, and any thumbs up I can get is appreciated. Thank you and take care and happy holidays. Hello?
Hi, is this
Hi.
Carrie?
Yes, it is.
Hi, Carrie. Cynthia, how are
I
you?
am good. How are you?
I am good.